Then there are some misconceptions. A lot of people think that vitamin D and osteoporosis don't have much relationship, but now with the talk, you know that they actually can prevent falls and prevent osteoporosis and therefore prevent fractures, right? And then another misconception is that those who live in sunny Singapore don't have to worry. But I have explained to you that because we like to use the so-called umbrella and go and hide under the hide in the shade. That's why in Singapore it's also a bit of an issue, especially in the older people. And then we also sometimes think that we can take enough vitamin D from the diet. Actually, it's not so easy, huh? Yeah. So sunlight is still the better source. For calcium, you can take enough from the diet, but for vitamin D, actually the sunlight is a better source. Then where you cannot get the sunlight, then supplements may be helpful. Okay. So just a summary. Dietary intake is only a minor source of vitamin D, and it's actually important to have enough vitamin D because it's essential for calcium absorption as well as bone muscle health. And then inadequacy of vitamin D is quite common even in Singapore. And then supplementation has been shown to reduce risk of fractures, falls, and perhaps less chance of autoimmune disease, but you need to treat a lot of patients to prevent one. So I think it's just important to have it as healthy lifestyle rather than to say I take vitamin D as a drug to try to prevent an illness, right? Just make sure that it's enough in your body, then that will be the best, okay? High doses are well tolerated, but more than like say 500,000 is not good, right? So you must be careful. When you want to take high doses, work with your doctor. Your doctor should be the one telling you to take those doses. Don't take on your own. And then, of course, we need to be compliant or adherent to the supplements to make sure that we have the benefit of vitamin D repletion and supplementation.